Hello, my name is Cody Alexander, and today I'm going to be explaining and talking to you guys about obsessive compulsive disorder, or more commonly known as OCD. Obsessive compulsive disorder, I believe, is often overlooked, and the term is used too loosely in our society. That's why I think there's kind of a misconception, because we do hear the term quite often, but in most cases, those people saying it have not been clinically diagnosed. But the severity is what differs person to person. The obsessions and compulsions are endless. Everyone's not the same, have the same symptoms regarding the compulsions and obsessions and habits. But you could be fully aware of these habits, but usually if you're fully aware, they usually make you more comfortable. They ease the tension, the anxiety, so that's why you keep doing them. But you could also be completely oblivious to whatever crazy obsession it's making you have. And right here we got a little diagram. It shows the stress and tension levels within the brain. This is a normal brain, and this is OCD, someone with OCD. And you can see it's a little more inflamed and distressed. Many theories and ways of how you develop OCD, it's still being researched every day. Doctors still trying to gather information to see what exact cause, where it starts, where it begins. But your lifestyle, certain experiences, traumatic or not, genetics, and your personality traits can all play into the development and extent of the disorder. That's why it can be kind of hard to recognize. And this chart says 1 out of 10 children ages 5 to 16 have a diagnosable condition. That's 1 out of 10 children, the whole world. Half of all mental health problems are established by the age of 14, and 3 out of 4 of all mental health problems are established by the age of 24. So as you can see, the disorder and a lot of other disorders tend to develop at a younger age and progress as you get older. How OCD happens is there's problems in communication between the frontal parts of your brain and deeper and further in the brain. Some things don't click, and there's still being research done on it. But people with OCD experience recurrent and persistent thoughts, images, impulses that are intrusive and unwanted obsessions. They also perform repetitive and ritualistic actions that are excessive, time-consuming, and become distressing, and they're just unnecessary. OCD has been shown to run in families, so that's one thing that doctors have been able to develop is OCD is genetic. So it doesn't mean if your parents have it that you automatically have it. You just have a greater chance of getting it. As you get older and you don't seek to get help and you don't seek to find change, the more it can worsen and lead to maybe other obsessions and stuff and other disorders, and it can just take over your life and keep you from living a healthy and fulfilled life. Signs and symptoms. It's usually a fear or a phobia of something, whether it's germs, illness, getting in an accident so you don't take any risk, or excessive concern of something, and which causes constant repetitive actions. OCD is compounded by depression and other anxiety disorders, including social anxiety, panic disorder, and separation anxiety. So you get a lot of that when we talk about OCD. If you have OCD, you're more than likely to have some type of anxiety disorder. The signs may be minor in the beginning, and your compulsions may be messing with your hair or something, but as you get older, and if you don't change or seek help, they can, like we said before, they can just get in the way of living a healthy life and progress and lead to other damaging factors. And it may not be harming that person's life, but it can affect other people's lives around you, so you just need to get help. Preventable measures. OCD can be genetic, so it's kind of nearly impossible to stop your brain from developing OCD, but there is certain steps you can take to slow the progression uh, of OCD. The biggest thing you need to do is seek help, and telling someone is the most important thing. Especially if your symptoms are harming to yourself, and like we said, they don't, even if they don't harm you, they could still have an effect on other people. OCD is tied to stress, depression, and other emotions. You see it more in today's age, the importance of mental health, and it affects more people than we know, and that is because a lot of people don't reach out. They suffer in silence and refuse to get help, but in the long run, it's better off to get ahead of it while you can before it gets too bad. Diagnosis is done through evaluation of a professional of your symptoms, physical health. You'll just talk to the doctor, and that's how someone is diagnosed. With not knowing the exact cause in the brain of OCD, making a diagnosis can be difficult at times, but usually doctors are able to tell. There's no laboratory tests or blood tests that says, oh, you have OCD or whatnot. But there is cognitive screenings that can be done to help a doctor make a diagnosis, or that they may show lead to other anxiety disorders. Prognosis. OCD is very common and very manageable depending on the severity and how long it goes on, and the support and help you seek to find. The most common treatments are some sort of medication and then counseling, therapy. Usually both of those combined is what you would have to do, or what the doctor would prescribe you to do. They tend to be successful if you keep doing them and keep doing them as prescribed. And the prognosis for OCD sufferers is best when the person's symptoms are milder and have been present for a short time and has no other emotional problems. So what this really means is the sooner you think you might have it, the sooner you realize your obsessions and compulsions, the sooner you need to go to the doctor, and the better off you're going to be. So the big thing, prescription and modifications. People with OCD are still fully functional and capable enough to complete just as many different activities and tasks as someone with OCD. So just because you have OCD doesn't mean you can't play football. It doesn't mean you can't play volleyball. You can't compete in the Olympics. Not at all. It's not one of those. And the degree of a person's case of OCD, or if they have any triggers or any specific gimmicks that make them shut down, is what you'd have to worry about, and that will tell you what kind of precautions and modifications you'd have to take. The most important thing to do as a teacher, if you were notified a student has OCD, is you need to research and be knowledgeable of OCD and what it really is, and meeting with the student prior to class and talking things out. With OCD, depending on the severity, the child is probably still going to be pretty functional and able to do all the activities. It just depends on the severity, like we said. And some examples of the steps you would take as a teacher. If a student has a trigger of if things aren't organized, like colors or equipment by sport. Say a student, if all the hockey sticks, all different colors, he has to have them red, blue, green. He has to put them all together. That's something you would find out through research and through talking to him, or even his parents. You could find out all their triggers. Or if they struggle with a certain activity, certain sport sets them off in their head and they shut down or they panic, you guys could talk through that and do alternative activities if you have to have the sport in your curriculum, or you just push that aside and you develop another different plan and you guys just avoid the whole thing as a whole. And make sure as a teacher you would if there was specific triggers or gimmicks that the student had that set them off, you would need to, before class, let the other students know, and so everyone is aware and everyone can avoid those triggers and just awkward and hard situations. So it's really about preparation as a teacher for modifying your class for a student with OCD. It could be easy or it could be difficult. It just depends on the child, the student, and the severity of OCD. It's a very wide range, so that's what makes it difficult sometimes. Support organizations. There's a lot of different organizations out there, and there's getting more and more by the year, because mental health is such a big issue in our society. But for OCD in particular, there's the International OCD Foundation, Peace of Mind Foundation, Anxiety Disorders Association of America, ADAA, and then an organization called Beyond OCD. And all of these organizations just spread awareness of OCD and other mental health conditions and anxiety disorders, and they give you a lot of different options. They tell you what you should do, who you should see, what treatments you should look for, but the biggest thing is you just gotta reach out to someone. You can't just hide and keep it to yourself. It'll just kill you mentally. It'll get to you. Mental health, again, is just a big deal in today's society. Like we've said multiple times, the biggest thing for something like OCD is to seek help. The sooner you seek help, the better off you'll be in the long run. The better off your health will be in the long run. The happier you'll be, and the quicker you can just live a better life and not have to worry about it. It doesn't mean it'll go away completely. Sometimes you'll have it the rest of your life, but you just have to upkeep certain medications. And a lot of times you'll see children, they have compulsions and obsessions, but they can grow out of them, especially if they get treatment and medication. So that's a huge thing too. Reach out. You don't have to be afraid, especially something like OCD. It's very common. Pretty sure a lot of us can relate, and it's unavoidable. You can't avoid something like OCD. So if you got it, spread awareness, get help, start today. It's a lot more common than people think, but there is still that misconception. Just because you play with your hair a lot doesn't mean you have OCD. Some people really suffer harshly, and it can lead to depression, anxiety, and even suicidal thoughts. And it's just all about mental health. Take action. Even if you don't have OCD, or even if you don't know somebody with OCD, or if you do, you can still spread awareness. You can still encourage people to reach out to get help. And that's the biggest thing with something like this. And if you have someone with OCD in your class, or in your grade, or if you're a teacher, it's not a huge issue. It's very manageable, and you can still have a fun class and the student can get everything out of it. And that's what OCD is. So just take action and start spreading awareness to get help today. And that is everything. So thank you.